My name is Blake Garside. I'm an orthopedic surgeon and sports medicine specialist at Tennessee Orthopaedic Alliance. One of the most common questions I get asked is ice or heat. What should I do after I've had an acute injury? Well, the majority of the patients I see have injured their ankle or injured their knee or have pain in their shoulder after any activity. The first thing that we try to do is encourage them to use ice. Ice decreases the inflammation, decreases the swelling, and helps with pain typically for the first 3 to 5 days. When treating your acute injury, remember RICE: rest, ice, compression, and elevation. R, rest the joint or stop the activity that caused the pain. I, ice the extremity or the joint, which will help decrease the inflammation. C, compression. This involves either applying a brace or a sleeve to the injured joint. And finally, E, elevation. Elevate the joint above the heart to help decrease swelling. Heat can be beneficial in a patient who has a back injury, but should be avoided on most of the joints, such as the shoulder, knee, or ankle, because it will increase your swelling and increase your pain. I would encourage you first and foremost to use ice and follow a simple mnemonic of rest, ice, compression, and elevation after any acute injury. RICE. If your pain and swelling persist after several days, please give us a call and we'll be happy to take a look and evaluate your injury.